risk. When compared to the city's current cost of health and dental insurance, United Healthcare represented about a 16% increase, and I did send to you that document that showed those numbers, so you all had that as well. Coventry, about an 8%, Midwest Public Risk 4%. In addition, to the rate increases, United Healthcare and Coventry, there would be additional expense for administrative cost, potential run-on claims. I will tell you, I was not completely familiar with that, so we did a lot of talking to our broker about what are run-on claims. And those were the claims that may be provided, may be submitted from a provider. Might be a hospital, might be a doctor, might be a physical therapist, whatever it is, after the 90 days that they're allowed to turn in claims. So that's a risk that the city, we would have to take under advisement that we could potentially be held responsible for those claims. I can't tell you that we would be, but it says maybe. So I need to make you aware that that's something that we would have to look at. The broker included and told us to include about $10,000 as a minimum to put out there for us, because there would be some money that we would have to use in switching over from the pool to a different provider. So that was also included in those numbers that we provided you. And then other administrative costs are kind of unknown at this time, and we just won't know until we would start working with the other providers, which would be Coventry or United Healthcare. A couple things, too, that I want to make sure that you all understand as well is within this, and I think that we were a little bit surprised as well as what the quotes came in. I think we were thinking that they may look a little different. We have 85 insured participants, so we're going out to bid insurance for 85 people. You know, we have 120 employees, but 85 take our insurance, so we're going out with 85 people. Also included in that is we have an employee assistance program. There's wellness dollars. There is the dental component as well. GASB 45, which is a reporting requirement that we're required to report on. It's quite extensive. We do not do that at this time. The pool does that for us. And then, of course, COBRA administration and claims management. So we have to take all of those things into factor as well as the initial cost. So when we looked, and we did a very thorough analysis, we spent a great deal of time looking through this, both Cheryl and Laura, and they did an excellent job in doing that. And Laura is our financial wizard, going through all of what this means to us. And what we talked to you about was that NPR and Coventry is very similar. There's so many unknowns that we don't know about, and our recommendation, looking at the carrier and what council's desire was to mitigate rising costs, we could not come back to you at this time with our professional recommendation to move providers. So, you know, there's another component, which is the budget component that we'll have to talk about, but what we were presenting to you was the question about who's our provider, who's our carrier. And so that's what we have presented to you in that document that was dated March 28th. So I'm happy to answer any questions or concerns and questions on the process or...
Which insurance company, Mary, decided not to give us a quote because they wouldn't bid against their own pool?
Cigna, because we're with the Cigna network. Cigna was the one who would not quote against.
And how long have you known about the quotes? I mean, there was we got the information, I think.
We've been working. I'm trying to remember the exact date that we
got board-approved NPR quotes on the 27th. Their board met on the 27th to approve their final rates.
Okay, but they had published, at least to the members, some rates before that they thought they would be.
Correct. We receive staff recommendations, much like when we provide kind of a recommendation to council, and then when we get the final approval, we are able to commit it. So they weren't able to commit it, but they did have some staff recommendations.
And how far back was that they had those?
I don't recall when we got those, because and part of it is until the board really approves it, staff's not able to commit them as final firm quotes.
I mean, it's a couple weeks before this or a month before?
don't know when we got those.
Within the last 2 weeks. I can look up the exact date for you. I don't have that off the top of my head, but it's been within the last week. couple weeks.
And as I understand it tonight, if we don't do anything, it automatically renews.
We will automatically renew.
That is correct, if you don't terminate tonight.
In past years, we've always been given the rates after the renewal date. Is that correct?
No. No, your renewal date is July 1.
Well, I'm sorry, the date by which you have to make a decision or you automatically renew. April 1st is the point at which you either pull out of the pool or you automatically are committed for another year.
I can't answer that without looking
Yes,
for you.
yes, that is correct. It is 90 days, so April 1st is the date that you make a determination to terminate.
So in the past years, have we received those quotes after April 1st? I mean, I know in 2011, the decision was made right before the election that Chris and I participated in the night before. So that was April 4th. So I'm assuming that the rates came after April 1st.
NPR usually votes on their rates with their board sometime late March. I can't give you the exact dates, but it's usually late March because they're waiting to get as much of the claims data in. Because remember, even though December 31st ends your year, claims data can still come in up to 90 days, and they're waiting to get as much of that claims data in and looking at their actuarials to make the decision on what the rates will be. So it's usually the end of March.
But in 2011, it was April 4th, so it was past the renewal date. And in 2012...
Sir, I can't answer that. I
Okay,
don't
well,
have that
In
information.
2012, we got the information on May 21st.
Okay, and your question is?
I guess my question is this the first year that NPR has given us the rates basically days before we had to decide whether to renew?
Again, I can't answer that. I don't have the dates, and I didn't, until last year, I didn't do this, so I would have to go back and research. I can't answer that from here tonight.
As far as the timeline goes, when did the bids come in for CBiz versus NPR?
We met with CBiz on Monday, the 26th, I think, and then we got the rates. The board met the next day.
So NPR came up with their rates the next day.
No,
They voted.
the board approved the staff recommendation. The staff, they work somewhat similar, like with council, we would send you a council packet with a recommendation and say, here's the staff recommendation, we recommend approval of, a particular item. So a staff recommendation with the packet was provided to the board, but the board didn't actually meet until the 27th to approve staff's recommendation.
But were the rates substantially different than what was known to be the case weeks before?
Do you recall?
I don't know. I was not involved in their conversations at NPR.
And who bid dental? Did CBiz bid on that?
They did not bid
No.
on dental.
So where did we get that number?
That's the number that is at NPR, and because we are grandfathered in NPR, the city is not required to put any contribution toward that, so the employee pays 100% of either the single or the family, and if you go out to bid, because we would not be grandfathered in anywhere, the city would be required to pay some portion, whatever that would be. They told us the rates would be comparable. We just had to take into analysis that we took what we have today and looked at a minimum, it's about 50% that we would be asked to pay, which would be a very nice benefit to the employee. It would be about a $37,000 increase to the city's budget if indeed we did do that.
But why didn't it show up under the column for NPR?
Because it's already included in that rate.
But NPR gave you the $37,000.
We determined the $37,000
From where did you get that rate?
from the rates that we have today.
From NPR.
Yes, sir.
So it could be less. I mean, we could.
All I can tell you is CBIS told us they would be comparable. I can't tell you that it would be, it might be $2 or $5, but for an overall view of a budgeting snapshot, it would be about the same.
But even if it's less, even if we took the 37,200 out and made it 0, you still have an increase of